Welcome to SLG Hello Doctor. As promised, we are back again this week with Dr. Jagan Mohan Reddy, Senior Consultant Orthopaedic Surgeon at SLG Hospitals, Hyderabad. Welcome, Doctor. Thank you for joining us.
Thank you.
Orthopedics is a vast subject with so many specialties and subspecialties. Today, our eminent guest will talk to us about partial knee replacement. So, Doctor, shall we begin?
Yes, definitely. I'm going to talk on the partial knee replacement. I will explain in detail about that. What is this procedure, how it works, and which patients are suitable for the partial knee replacement.
So, Doctor, first things first. What is partial knee replacement?
Partial knee replacement. What is it? So, what is replacement in the knee joint? The knee joint is a natural God-given knee joint. We'll have an articulation between the femur, that is a thigh bone, and the leg bone, that is a tibia. The tibia and femur forms a knee joint along with the patella. If the knee joint is damaged because of age related, it is wear and tear. If it is all three compartments involved, means whole of the knee joint is diseased, then we will replace the knee joint with the artificial joint. That is called a total knee replacement. Most of them you heard about this. But what is partial knee replacement? In the knee joint, in the subsector, we have three joints. One is a medial compartment, that is inside of the knee joint. Other one is a lateral compartment, that is outside of the knee joint. Other one is a patellofemoral joint, that is a front of the knee joint. If the disease is involved only that particular joint, for example, most commonly the medial part of that is inner side of the knee joint is wear and tear. Most commonly. In that case, we will replace only that part. Rest of the knee will be stayed there. That is called partial knee replacement. Partial knee replacement means we are doing only the diseased part. Damaged part of the knee is replaced with the artificial joint. That is called partial knee replacement.
So, Doctor, when should one opt for partial knee replacement?
Yeah, it's a very good question. So, when should we go for a partial knee replacement, or the patient has to go for a total knee replacement? That the surgeon along with the patient will make a combined decision. The surgeon will examine the patient thoroughly and he will decide whether that patient is suitable for half knee replacement or not. That is called partial knee replacement. For example, if the disease, that arthritis involves only the one compartment, either inner compartment or outer compartment or front compartment, then the surgeon will decide to go ahead with the half knee replacement. There are certain criteria. One is the deformity should not be more. If it is a severely deformed knee joint, not suitable for half knee replacement. And the ligament should be intact. One of the common important ligament is ACL. ACL should be intact and he should have a good range of movements, full range of movements, and no gross deformities, and ACL should be intact, and the disease should be confined to one joint only, either medial inner joint or outer joint or the front of the knee joint. That the surgeon will carefully examine and he will order some x-rays. He will order some special x-rays, that is called stress views, and sometimes we have to do an MR scan to decide that the disease is confined to that particular joint. And sometimes the surgeon has to do a keyhole surgery for a diagnostic purpose to make sure that the disease has involved only that particular joint. Then only we will make a decision that this particular patient is suitable for half knee replacement or not.
Which is the more painful of the two, partial knee replacement or total knee replacement?
The total knee replacement definitely is more painful than the partial knee replacement. Name itself indicates partial knee replacement means you are replacing only the part of the knee joint. So you have less bone cuts, less surgery, less time, less tissue damage in the partial knee replacement. Definitely the partial knee replacement is less painful when compared with the total knee replacement.
Are all kinds of patients suitable to undergo this kind of surgery? Because we've been hearing a lot nowadays about comorbidities and maybe there's an age factor. So can you take us through that?
Yeah, it's a very good question. Whether all age group patients are suitable for partial knee replacement. The literature shows even in octogenarian population, nanogenian populations in the Western world, they did a partial knee replacement with the good outcomes. So there is no age ban, no age criteria for the partial knee replacement. But as you know that age grows, if you become more and more senior, there is a very high chance of arthritis in the whole knee joint. If an elderly patient with the arthritis confined to only one joint, definitely he is suitable for partial knee replacement. Only thing is, I mentioned before that if the patient is suitable for the partial knee replacement that is confined to the one joint, ACL intact, full range of movements, no deformities, then confidently, comfortably can be done partial knee replacement. The age is not a matter, but as age grows, when become a senior, there is a chance, high chance of arthritis in the whole knee joint. In that case, the partial knee replacement is not suitable. But the literature shows that plenty of patients have undergone the partial knee replacement even at 80s and 90s. Your second part of the question is comorbidities. If the patient is suitable for the partial knee replacement, if the patient got multiple comorbidities. In fact, the partial knee replacement is a smaller surgery when compared with the total knee replacement. So the patient will be better tolerated. If the patient got a good high comorbidities, is more suitable for the partial knee replacement than the total knee replacement if he or she fits in that criteria.
Let's take a short break now.
Presenting SLG Hospitals, the next level medical destination. Envisioned by Sri Dandu Shivaramaraju and family. Powered by cutting-edge technology and compassionate care, this 999-bed tertiary care facility adopts the latest medical practices followed worldwide. Built as per JCI guidelines and NABH quality standards, SLG Hospitals offers a wide range of solutions for all simple to complex conditions in all specialties of medicine. SLG has been able to attract the best of medical talent due to its vision, sheer scale and scope. With matchless experience and expertise, they are SLG Hospital's biggest strength. The team is ably supported by advanced technologies, infrastructure and protocols to deliver finest outcomes for patients. SLG Hospitals, the next level of care.
In case the patient does decide to go for partial knee replacement, what is the duration of the hospital stay? And can you give us a rough estimate of the cost involved?
Duration of the stay. Actually, the duration of the stay is very, very important in the modern medicine. Previously, in the past, the last 2 decades back, if you do a knee replacement, they used to stay for weeks together in the hospital. But in the modern, with the new surgical technique, with the enhanced recovery, even the total knee replacements were discharging on the second day or the third day. Whereas a partial knee replacement involves the less surgical damage and it is a very minimal surgery when compared with the total knee replacement. We are doing as a day case or stay overnight. So the partial knee replacement can go home on the same day. If you do a surgery in the morning, we are discharging in the evening. Or if the patient is a little bit senior age group, we will keep overnight. So the discharge on the next day. Definitely the partial knee replacement has a less stay when compared with the total knee replacement. We can do comfortably and safely as a day case or maximum overnight stay for the partial knee replacement. Yeah. The second question in this is the cost. How much it will cost when compared with the total knee replacement. The cost almost will be the same when compared with the total knee replacement and the partial knee replacement. In fact, partial knee replacement is little bit economic when compared with the total knee replacement because less hospital stay when compared with the total knee, less medication, quick rehabilitation. Overall, if you take the partial knee replacement is less expensive than the total knee replacement. The cost, I can't give the exact figure. It varies from the institute to institute and surgeon to surgeon. But the cost is almost same to the total knee or little bit lesser than the total knee replacement.
So after the surgery, doctor, how long would it take for the patient to go back to their routine chores, to walk on their own? And what should the family be prepared with in terms of giving care to such patients?
This question comes under the rehab program. When can the patient can walk? And what are the things, whether he has to take any special precautions at home after the discharge. In the partial knee replacement, patient can walk on the same day. If the surgery was done in the morning, they will walk in the evening once the spinal effect goes off. He walks independently in the evening. First, he walks with the help of walker or the frame or with the crutches. Over a period of 1 to 2 days, he can walk independently. Some patients walks on the same day without any support. The no specific rehabilitation required for this. Routine physiotherapy is required to gain the movements to strengthen the muscles. No specific rehabilitation, no specific things required for this. The family or the relatives or the next persons need not take any necessary or need not order any special equipment at home. You can lay on the normal bed, you can use the normal toilet and normal walking. You can do the staircasing on the same day. There is no restrictions at all. You can sit in the normal chair, low chair, high chair, you can sit anything, there is no restrictions. But in the initial first few days or first 1 or 2 weeks, he will have a little bit pain and he requires a little bit physiotherapy to get back to the normal things.
Are there any side effects to be expected, doctor? Can the patient be more prepared, or can as I asked in the earlier question also, can the family be more prepared to expect some side effects and help the patient recover quickly, faster and with more confidence?
Side effects, yes, definitely any surgery there is risks will be there. But when compared with the total knee replacement, the side effects, the complications are minimal in the partial knee replacement. One is an infection. We will take all the necessary precautions and utmost care to prevent the infections. One is like laminar flow theatre, strict discipline in the theatre. We can overcome the infection rate. The other thing is stiffness, clot in the leg, clot in the chest. These are all very, very, very minimal when compared with the total knee replacement. The complications do occur in the partial knee replacement, but they are very, very less than 1% when compared with the total knee replacement or any other surgeries. So you don't need to worry about that much about the complications. The doctor, the surgeon will explain in details that a case to case. Suppose if the patient is diabetic, they should have a good glycemic control, that sugar control should be done in the post-operative period. That varies from the case to case. But in the overall, it is a very safe surgery compared with the total knee or any other surgeries. Less side effects with the partial knee replacement.
As a surgeon, doctor, how difficult would you say that this particular procedure is? Do you require special training for it, special technology and infrastructure that is to be used? Do all hospitals have this facility?
Yeah, it's a very good question and valid question. Whether all hospitals can do a partial knee replacement or all surgeons can do a partial knee replacement. No, the partial knee replacement is entirely different when compared with the total knee replacement. Partial knee replacement requires vigorous surgical training. It is a well-balanced surgery. It is a small error chance. If you do any small error, it will fail. Whereas a total knee replacement, you have a chance of small error can overcome with the total knee replacement. But partial knee replacement, it requires a good training to the surgeon, special equipment is required, and the hospital also should have prepared for that. Not all hospitals will do, not all surgeons will do the partial knee replacement. It requires a training, special training to do a partial knee replacement. If you have not done properly the partial knee replacement, it fails within a month. The patient will not have any pain relief and it will fail, and it is difficult to convert from the partial knee replacement to total knee replacement once if it's done wrongly. So my advice is check the credentials of the doctor and the hospital and choose the appropriate hospital and appropriate surgeon for the partial knee replacement. So the patients and their relatives, they have to choose very carefully about the hospital where they are undergoing the surgery, especially the partial knee replacement. They have to check the credentials of the surgeon, whether the surgeon got adequate training in that, whether he got a good volume of that type of cases. If you choose right surgeon, right hospital, the outcome will be very good in the partial knee replacement.
In the next week, we'll talk to Senior Consultant Surgical Oncologist Dr. Sridhar about cancer and more particularly about lung cancer and breast cancer. Until then, stay safe, stay healthy, be good. Subscribe to our YouTube channel SLG Hello Doctor to catch our fortnightly capsules of knowledge sharing. Don't hesitate to fill our chat box with any questions or queries you have for our panel of experts and get the best advice from them.